How do blood pressure medications dramatically reduce stroke risk? Imagine a tiny blood vessel in your brain suddenly bursting or getting blocked. That's what a stroke is. High blood pressure is a major cause of this, but the good news is that medications can help prevent it. Blood pressure medications work mainly by controlling high blood pressure, which is a key modifiable risk factor for stroke. When blood pressure is too high, it puts extra stress on blood vessels, causing damage over time. This damage can lead to blood vessel walls weakening, inflammation, and oxidative stress, all of which increase the chance of a vessel either bursting or becoming blocked in the brain. By lowering blood pressure, these medications reduce the strain on arteries, helping to keep blood vessels healthy and less likely to cause a stroke. Different types of blood pressure medicines have unique ways of helping. For example, calcium channel blockers relax blood vessel muscles by preventing calcium from entering cells, which causes the vessels to widen. This reduces resistance and blood pressure, making blood flow smoother and lowering the risk of damage or clot formation. Angiotensin II receptor blockers and ACE inhibitors block hormones that cause blood vessels to narrow and make the body hold onto extra water and salt. This keeps arteries open and reduces blood volume, which helps lower blood pressure and protects the blood vessels from damage. Beta blockers work by blocking signals from the brain that make the heart beat faster and narrow blood vessels, which decreases blood pressure and reduces the workload on the heart. Some of these drugs also help improve how the body's natural blood pressure regulation system, called the baroreflex, functions. This stabilization helps keep blood pressure steady and can lessen the severity of strokes if they happen. Research shows that lowering systolic blood pressure significantly cuts the risk of stroke. But it's important to remember that some people find it harder to control their blood pressure, especially if they need multiple medications. That's why early treatment, lifestyle changes like healthy eating and exercise, and sticking to prescribed medications are so important. Managing blood pressure not only reduces the chance of blood clots, causing ischemic strokes, but also lowers the risk of bleeding in the brain from ruptured vessels. Because high blood pressure often has no symptoms, regular monitoring and working closely with healthcare providers are essential. They can help find the right medication plan and manage any side effects. In the end, blood pressure medications protect the brain's blood vessels by preventing damage, narrowing, and rupture, which are the main causes of stroke. Staying on top of blood pressure control is one of the most effective ways to keep your brain safe and healthy.